Considerable research links inflammation to various kinds of mental health problems. Hafizi and colleagues report an important new study that actually can measure inflammation in the brain using sophisticated positron emission tomography techniques. The main finding to emerge from the study suggests that there may not be inflammation in the brain among patients with schizophrenia. So while this is an early study and the findings are far from definitive, it raises questions about being cautious before closing the book on what we think about the relationship between inflammation in the central nervous system and the diagnosis of schizophrenia. One of the strongest findings in research on anxiety is that there is a tendency in patients with clinical problems in anxiety to label things as dangerous that other individuals view as safe. Kaczynski and colleagues examine this question as it relates to the diagnosis of post-traumatic stress disorder. And they use brain imaging methodology to actually map the underlying neural correlates of this process that we call overgeneralization. The key findings to emerge from the study suggest that this tendency to overgeneralize among patients who have the diagnosis of post-traumatic stress disorder might arise from perturbations in the brain's underlying fear circuitry. And this is likely to encourage other attempts to replicate the findings and see what such findings can tell us about novel forms of treatment.